My name is Karishma Patel and I have worked at 111 Harley Street for 8 years now, and my role here is as an aesthetic nurse prescriber. And the most renowned treatments that I do over here would be botox and fillers alongside rejuvenation treatments. What's wonderful about this job is you get to combine your knowledge in human biology and facial anatomy with your artistic and creative talent, and you get such a good feel-good factor from patients as well. The most popular treatments non-surgically that we do at 111 Harley Street would be botox and fillers, which help to address lines and wrinkles and facial volume loss. So when a patient comes in for a consultation, I would first start to understand which is their main area of concern, and then we can address other issues alongside the different facial features on the skin, as well as any kind of textural or skin issues we can go into as well. There's three main treatments which we do. Number one is mesotherapy. Mesotherapy is really good for helping to revitalize the skin and pump the skin full of hyaluronic acid, amino acids, as well as vitamins. It can also be used for hair growth as well. Then treatment number two would be something called Profilo. Profilo is a really large content of hyaluronic acid, one of the largest contents in the market. And what it helps to do is it helps to hydrate the skin as well as address crepey skin, and it can also create lifting of the skin as well. Then treatment number three would be something called PRP. PRP is basically using a patient's own platelets, inject it into the skin, and it can help with healing factors in the skin, as well as stimulate the growth factors which produce collagen. So if one was to ask me and wants to address an area on the face which is like a localized area, and they had lines and wrinkles in this area, this small localized area, then it would be botox and fillers which would best address this. If we are treating generalized areas, then we're going to be looking at combining treatments. So using botox and fillers, as well as using rejuvenation treatments alongside this as well. So skin hydration can be addressed in a variety of different treatments. So as we've discussed before, rejuvenation treatments such as Profilo, mesotherapy, as well as PRP can really help with the hydration of the skin and retaining water in the skin. Profilo is really good for making the skin look so glowy and like giving the skin like a lovely marbly effect. So a patient with a sensitive skin can have injectables done as long as their skin is intact, and as long as that patient doesn't have any contraindications alongside the injectables that we will be doing. Okay, so as long as they don't have any type of contraindications going on, then it's absolutely fine to have injectables done on a sensitive skin. Top treatments for a patient in their 20s would be non-surgical treatments such as using chemical peels, using mild lasers on top of the skin. If one had an obvious need of lines and wrinkles, then botox and fillers can be employed, but it can also wait. Pixelated and fractional lasers are really great for helping to treat textural issues on the skin. It can help to treat crepiness because it exfoliates the skin as well. It will help with collagen production in the skin. And if one wanted to, you could employ treatments such as botox, fillers, and PRP as well to help to stimulate the growth factors in the skin. Botox, fillers, Profilo, a combination of PRP as well as mesotherapy, and something called soft thread lifts can really help with lifting of the skin. we can use injectable treatments as well as lifting devices. So lifting devices such as thermage, we have a device called Accent as well, which is really lovely for helping to lift the skin, and we can also employ soft thread lifts if necessary as well. So the most common side effects after injectables would be redness, swelling and bruising. Botox can also be used for conditions such as hyperhidrosis, migraines, people that are suffering from headaches. It's also used in specialized areas for people having bladder problems, as well as neurological problems such as cervical dystonia. And a lot of male patients that will have a Botox done for localized areas, as well as fillers done mainly for like the chin and jawline, just to give a stronger jawline, or if one has any type of like nose irregularities, it can be very helpful. And then as well as skin issues, so problematic skin, so such as acne or scarring on the skin. So my top 3 favorite treatments are Botox, because it treats so many different conditions and it's very safe if you're treated by an injector, an experienced injector. I also love PRP because it's a really natural treatment. You're using your own human bodily fluids to create a very pleasing natural result. And treatment number 3, I love Profiler. Again, it's a very safe and effective treatment to help to treat so many different things such as hydration of the skin crepiness, give you a little bit of lifting of the skin.